Hi, I'm Dr. Marcia Sirota, and today I want to talk about toxic relationships. Now, lately we've been seeing a lot of news about the Johnny Depp Amber Heard trial, and it's quite an unusual circumstance because we rarely get a glimpse into the very deep interpersonal dynamics of a couple as we are with this couple because they're in court and it's public for everyone to witness. And we're getting to hear some very, graphic stories of their interpersonal dynamics, which sound quite dysfunctional. And the other day, a psychologist hired by Johnny Depp's team diagnosed Ms. Heard with borderline personality disorder and histrionic disorder. And it's an interesting thing because obviously it's hard to diagnose these conditions. The psychologist was with Ms. Heard for about 12 hours. And of course, the other side is calling foul and saying, you can't say that. You're just saying that because you're on the other side. But let's say it's true. Let's say Ms. Heard does have some personality dysfunction, and this is driving some of her behavior toward Mr. Depp. Now, one of the things I've seen as a psychiatrist for many decades is that when one member of a couple has a severe personality disorder, it can actually bring out dysfunctional behavior in the other person. And I'll explain why. So let's say, just for the purposes of this discussion, that Ms. Heard does have a personality disorder and her behavior toward Mr. Depp was erratic, impulsive, aggressive. Maybe she was gaslighting. Maybe she was being very confusing and upsetting. Well, it's very easy in an intimate relationship with somebody who is so dysfunctional for an otherwise healthy person to regress. And by regress, I mean to go back to behaviors that they exhibited when they were a child. Because when you're with someone who is behaving childishly, it can be easy to kind of drop down to their level and become childish with them and do impulsive, irrational things in response. Now, that doesn't mean that the other person would naturally behave this way. It's more about this kind of behavior being elicited by the toxic individual who has a personality disorder. So if, let's say, Ms. Heard was behaving in certain ways, it might have precipitated certain responses by Mr. Depp. And so instead of saying that Mr. Depp is a bad person because he did X, Y, and Z, you can say that Mr. Depp might have been responding with X, Y, and Z to certain behaviors on the part of Ms. Heard. Now, again, I'm not saying that that's the case at all. I'm just saying that for argument's sake, just to discuss this topic in general, using them as examples. I certainly don't want to say anything because I don't have any knowledge whatsoever of the realities of their relationship. It could be completely different. I'm just talking theoretically using them as examples. But let's say that Ms. Heard does have these disorders. So borderline personality disorder, to explain, is a personality disorder that's characterized by poor insight on the part of the person, poor judgment, which means making bad choices, making bad decisions, impulsivity, which means acting before they think and engaging in certain kinds of impulsive behaviors, possibly addictions, possibly self-harming, possibly suicidal thoughts, even attempts. And it also can involve a lot of irritability and aggression. It can involve a lot of cognitive distortions, which means the way they're thinking is very distorted. And so their thinking doesn't necessarily make sense and they don't necessarily listen to reason. Another aspect of borderline personality disorder is a lack of insight. So they don't understand what's wrong with them. They don't understand the extent of what they're doing. They don't understand how they're hurting other people. And so all of this can cause a lot of damage on the part of their significant other. They can really cause their partner to suffer a lot, and also they can cause their children to suffer. Now, histrionic personality disorder is slightly more rare, and it's a very interesting disorder. This is a disorder of somebody who needs a lot of attention. They want to be the center of attention. Their relationships tend to be very superficial, but they feel that they're closer to people than they actually are. They tend to always want to be the one who is seen as wonderful, or they like to be seen as the victim being rescued. And it's very much about attention seeking. And they tend to dress very flamboyantly. They tend to behave quite flamboyantly as, attention-seeking behavior. And they will be provocative. They will be seductive. and they will not really understand the implications of what they're doing. So they will be very provocative and seductive. And when people respond to them, they'll go, I don't understand why you're treating me this way. So that's the histrionic. So when you have a combination of borderline and histrionic traits, you can be impulsive and aggressive, but also provocative and seductive. So if that's combined with somebody being very beautiful and talented, you can see how they can, like a spider, snare you in their web, and you can get into a lot of trouble. Now, again, I'm not saying that Ms. Hurd has either of these diagnoses. There's no way for me to know. I haven't examined her personally, and I really, can't comment on her personally, but I'm just saying for purposes of this discussion, we can, let's say pretend that she did, and then we could explain Mr. Depp's behavior theoretically by his responses to that. So let's say, Ms. Hurd did have these diagnoses. It could really explain some of Mr. Depp's responses, because when you're in a relationship with someone who has these kinds of personality traits, like I said, you can regress and then you can become your worst self. So if you're looking back at your personal relationships and you look at any of the relationships in which you really found that you were being your worst self, sometimes that can be in response to a relationship with somebody who has a personality disorder. And because of that, you can regress and become very dysfunctional yourself, because you are probably frustrated, irritated, confused, and also because they are acting in a very childish manner, it's easy for you to kind of drop down to their level. So when we see two people in a very dysfunctional dynamic, sometimes it's because both people have problems, but sometimes it's because one person has quite significant personality disorder issues and the other person happens to have regressed, has dropped down to that level, and they're being their worst self in response, and they might find themselves doing things that they never would have done in any of their previous relationships, including being physically assaultive in response to some kind of crazy-making behavior, including losing their temper and screaming or punching the wall. People can get so frustrated that they really lose their cool in response to somebody with a personality disorder. Now, even the healthiest person is at risk of really having a hard time if they stay long enough, because if you're in an environment that's very toxic to you, it's inevitable that you're going to get poisoned, and at some point you might end up doing something that you regret. So my advice for you, if you are in a relationship with someone who's exhibiting any of these personality traits, or if you're with somebody who has sociopathic traits, which is somebody who is a liar, a cheat, a thief, somebody who is constantly behaving in kind of criminal ways, or who are cheating on you, or who are emotionally or physically abusive, or who are constantly making you feel confused, frustrated, upset, irritated, angry, unhappy, who makes you feel bad about yourself, the best option is to walk away. Because if somebody is truly significantly disordered, it's not really likely that you're going to be able to communicate with them in a reasonable manner. It's really unlikely that you're going to be able to negotiate in good faith with them. These people tend to be rigid. They tend to be unable to take responsibility for their own actions. They tend to put the blame on others and not take any responsibility themselves. So it's your fault that they did what they did. You provoked them. You're the one with the problem. You don't understand them. You should be more kind, caring, tolerant. And what they did wasn't such a big deal anyway. So the best option really is to walk away, because the longer you stay with somebody who is toxic and personality disordered, the more likely it is that you're going to do something that you regret later, or say something that you regret later, and that you might get in trouble for. So I have seen in the hospital someone coming in because they got brought in by the police because they were screaming on the street in response to somebody who was mentally ill. And they were the ones who got brought in because the mentally ill person calmed down enough to tell the police, I don't know what's going on. This person is having a fit. And so I interviewed the person with the fit. And when they calmed down, I saw that they were simply having a fit in response to the other person's mental illness. And they weren't, quote unquote, the crazy one. And interestingly enough, I was on call. It was my training. So I was on call 2 days later, and the other person was brought in, and that person I admitted. So Moral of the story is the best way to deal with somebody who is severely personality disordered is to identify their behavior as soon as possible and just walk away in the most gentle, casual way that's not going to make them mad. Or if you have to do it by sneaking away or running away, do that. Get out, basically. Get away from them, because the longer you stay in that toxic environment, the more likely it is that you will regress and that you will get yourself into trouble. And the consequences might be quite severe. Look what's happened to Johnny Depp. Who knows if that's why, but if it is why, that's very unfortunate. And I've certainly seen in real life, in my practice, people getting into some significant problems because of their interactions with people with severe personality disorders, including going to jail. I had an acquaintance who ended up in jail for a year because he married someone who was very severely borderline personality disordered. And in their interactions, she got him into difficulties, let's say, because the other thing about the borderline is that they're extremely vindictive and extremely punitive, and they will go to great, great lengths to get you into trouble if you have angered them. And that also goes with someone who is histrionic potentially, and definitely someone who has antisocial personality disorder or who is sociopathic. So you really want to get away sooner versus later, because once you've gotten them mad, they will try to destroy you if they can, and they don't consider their own safety or the consequences of their actions. So they are prepared to do things that ordinary people would not do. They don't have the normal checks and balances or limits that you and I have. And so they will do things that you would never have even imagined. And they're also very good at being tricky and devious for some reason. Maybe that's part of the disorder. So you don't want to get them mad, and you don't want to stick around long enough for them to feel like they need to punish you, because then you're really in for a world of pain. So moral of this story, identify early the signs of personality disorders. And if you're not sure, read on it. There's lots of information online and in books about personality disorders. Study it well so that you are forearmed and forewarned. And so if you find yourself happening to be with somebody who has a severe personality disorder and they are a problematic person, because not everyone with personality disorders are difficult. Some people have mild versions and they're perfectly fine, and they might have a few difficulties, but they're not going to really take it out on you or make you be the worst version of yourself. But if someone is severely disordered and they're toxic, the best option is to get away before you get yourself into trouble. I'm Dr. Marcia Sirota, today talking about how to deal with toxic relationships, and hint, hint, the best way to do it is to identify and get away. And I will be bringing you more content very soon.